So what are health disparities? Essentially, they are the differences that are closely linked with many of the factors that I just mentioned. They adversely affect specific groups of people who have systematically experienced obstacles. And we're talking specifically about health today due to their race, ethnicity, religion, socioeconomic status, etc. They are often preventable differences. When you think about the burden of disease or injury or violence, they are preventable differences that really interrupt a person's opportunity to achieve their optimal health. In the graph on this page, although some of the data originally that was put on the graph is a little dated, the unfortunate part of this discussion is that many of these disparities remain. When you think about stroke and cervical cancer, there are still, and infant mortality, there are still significant differences between populations based on race. So why is it that we would even think about focusing on health disparities? Why is this important? Well, let's start with some basic demographic data. At the end of the day, our country is changing. The demographics of our population is changing. If you look back to 2016, about 40% of the population in this country were people of color. Fast forward to what is projected for 2050, over 50% of the population in our country will be people of color. Why is this important for us to think about? If you go back to the previous slide and look at how disparities are captured in our country and the disproportionate impact on various populations, especially people of color, we should all be worried, because what we will see if we do not change some of these trends is an increase in negative health outcomes for a larger proportion of our population. So let's shift specifically to COVID-19. This has provided us with an opportunity to really watch the unfolding or the development of a new health disparity right before our eyes. So if you think about some of the core data related to COVID-19, globally, there are over 35 million cases and over 1 million deaths. In our country, over 7.5 confirmed cases and over 200,000 deaths. These are staggering statistics and very, very concerning. But what we also know is that behind this data are some very, very disturbing stories and statistics. So let's come home to Virginia. Now, when COVID-19 first unfolded, we were all very focused on the impact on our senior population. And even today, as we look at what is happening in regards to this pandemic, the vast majority of individuals who are dying as a result of COVID-19 are individuals who are 70 and above. And that is both at the state level, at the local level, and across the country. However, what is very interesting is that when you look at the distribution of the cases, we are now starting to see a shift in an increase in cases in younger populations, specifically in the 20 to 29-year-olds. Now, while the risk factors are much lower for the 20 to 29-year-olds, we are seeing significant increases in the cases. While the death statistics are not reflecting directly with the prevalence of the disease, it still raises the question of, shouldn't we all be concerned, because what we're looking at is a preventable trend. interestingly, somewhere around mid-April, March to April, we started seeing some publications that brought up this issue of, is COVID disproportionately impacting populations outside of our seniors? And our public health officials began to publish to really raise the awareness as they were collecting data that showed us, not only from an age perspective, but from a racial and an ethnicity perspective, that there was something else behind these numbers that we needed to be concerned about. Some of the most recent data that's come out of the CDC has truly confirmed that there is an issue that we need to be thinking about as it relates to how COVID-19 is impacting brown and Black individuals in our country. This chart basically shows that when you do a comparison on brown cases, hospitalizations, and deaths, what you see are disturbing statistics. Whereas American Indians and or Alaskans or natives have 5.3 times higher the hospitalization rate than whites. African Americans, 4.7 times higher, in our Latino population, 4.6 times higher than whites. Also, when it comes to cases, you can see the disparities across people of color versus whites, and also from a death perspective, 2.5 times higher for African Americans than for whites. These are all disturbing statistics as we think about the communications activities, the efforts that are underway to try and help prevent the spread of the disease.